flu shot. Good morning. Before I begin, I want to reiterate how important it is for everybody to get their annual flu shot. Getting the flu shot is important every year, but given the pressures that we are seeing in our healthcare system, it is especially important this year. The flu vaccine is a safe, effective, and simple way to prevent illness for yourself and others. A simple way to keep your loved ones and yourself healthy. I know we all have busy lives, and I know it's easy to say I'll get around to it later. How easy it is to think that the flu shot is no big deal. Please make time to do the right thing and to be able to make time to get your flu shot as soon as possible. We have just finished celebrating Thanksgiving, a time to give thanks to things that we have otherwise taken for granted. I am thankful for my health and the health of my loved ones, and I'm also thankful for the vaccines that have helped make that possible. We have lost many lives to COVID-19 over the past year, but thanks to our provincial vaccination team professionals working hard, we've been able to stick it to COVID, and we've even saved more lives. Let's all remember and give thanks for it, and please take the time to get your flu shot. Now it says I'm going to go get my flu shot, but I've already got that, so I'll be happy to answer any questions.
In terms of COVID-19,
yes.
have we seen our peak yet, or what's modeling showing us that we can expect in the next few weeks?
Well, we've seen actually in the last couple of days some lower new case numbers, which is encouraging. I would say it's a little too early to say that that's a trend right now, but it is encouraging that the numbers have seemed to have peaked and starting to plateau over the last couple of weeks and now starting to come down. So hopefully that trend will continue, and I think it's attributed to a few things. It's attributed to our vaccination increasing, that we're doing over 2,000 new shots a day. And also the restrictions that we've put in, the QR code, the restrictions within businesses and certain events, I think that's helping as well.
Do you know how many patients Ontario is willing to take should we get to that point? How much would it cost us to send someone there?
I don't have the exact cost of that. I did talk to Minister Elliott yesterday and touch base with her. They were very welcoming. If we needed any help, they were prepared to do that. We haven't got into that. What happened in the past is when we took patients from other provinces, we did it in very low numbers, 2 or 3 at a time, just to be able to relieve some pressure and then move that out. So we haven't got a hard number from Ontario as to how many they would take, but the minister offered any help that they could offer Saskatchewan, and just said to give us a call, and we'll reach out when we hit that point.
Pardon for my ignorance, but why aren't we asking for help from the federal government? It hasn't been really clear for the public or I think the media.
We have asked for the federal help. We have asked in lots of ways, going back to the original and the procurement of the procurement of the COVID-19 vaccines, on the needles, the instrumentation, the ventilators that we've been able to get from the federal government. We've been working with the federal government throughout this in lots of different ways. But let's be clear that there's not a huge pool of ICU nurses that the federal government has access to. Alberta did reach out, and they got the equivalent to 8 ICU beds opened up from the federal government. So we're working with other provinces as well as the federal government to make sure that we're addressing this as much as we possibly can.
But don't we have finite resources too? And how do we know that they have finite resources? Did they say that they can only give us a certain amount? What did they exactly tell you that you're getting this information from?
Well, we've had several conversations with them as far as what they can offer, and we have taken them up on several things. And it's not that we have excluded the federal government. We've been very inclusive of the federal government. I talk to the federal minister probably every 2 weeks, excluding when they were during the writ time. We did have discussions ongoing to see what it is the federal government can offer. We've reached out as far as tests. We're getting the rapid tests from the federal government. We've got a few million in already. We've got a few million coming in. That's something that we've been working with the federal government. We've also been working on the antibodies, the approval of that. So we have been working with the federal government. We just haven't reached out for the resources as of right now, because right now the SHA is telling me that they have the resources in place to meet our needs. And if we get to a point where we can't be able to provide that quality care, then we're going to look at other provinces to be able to assist us.
I'm sorry, last question for me. If we did bring in personnel from the federal government by way of the Canadian Red the military, would that be able to help us avoid sending patients out of province? Because we have heard the likelihood of sending patients out of province would increase the likelihood of death in severe cases.
Well, we would have to look at that on a case-by-case basis. It's much easier for us to be able to move people out of province and they be treated in care in the community that the practitioners are able to provide that care. Instead of pulling people into our system, it's sometimes easier to move out, but we'd have to do that on a case-by-case basis.
You mentioned rapidness, but the human resources are really missing right now. What could you do about it?
Well, with our Emergency Operations Command Center, we're looking at efficiencies that we can free up resources. So we just had a meeting this morning. We have a morning meeting every morning to be able to discuss what's going on with the SHA, with Marlo Pritchard and his group, as well as the ministry. We're looking at finding efficiencies in there that we can free up some healthcare workers, nurses. But the ones in the ICU are very specialized positions. These are highly trained individuals. So it's not like we can just pull a nurse off of any situation to be able to move into that area. We have to have that highly specialized training. And the nurses that have been doing this have been doing an absolute amazing job of this.
Yesterday, Scott Livingston said that this new PEOC command center would effectively do nothing to lower ICU rates. What is the province doing on that front?
To lower the ICU rates? Well, the main thing that we're doing is vaccinations, is trying to lower the ICU rates. Every person that comes into the hospital, into the healthcare system, is assessed whether they into that acute, and sometimes people do have to move into ICU. This is about streamlining our process so we have information that is extremely accurate, that we can make decisions on that in a timely manner.
But beyond vaccinations, healthcare workers say they don't think they've seen the worst of the ICU numbers yet because it's expected to peak in a couple of weeks when we see the high case numbers reflected in those hospitalizations. What is the province doing in the immediacy to help that?
Well, as I just outlined, that we're freeing up some resources. We're looking at nurses that we can move out of certain positions that we're doing things within contact tracing and other areas to be able to reallocate them to. And again, it's not like there's ICU nurses that are not being utilized to their maximum capacity. If we hit a certain threshold of that number where we were close to last weekend of ICU capacity, then we'll start looking at out of province. We have all of the plans in place to be able to move people out of province if need be, but we're not there right now.
A lot of healthcare workers are calling for more restrictions like gathering limits to reduce the number of hospitalizations in the future and also to make things more manageable for contact tracers. Why are we not seeing those?
But we have done that in all honesty. We have had restrictions. If you look back in the last 30 days, what's happened in Saskatchewan, we've had an emergency order put in place to reallocate healthcare workers. We have the QR code, which is unprecedented. This is something that the province has never had to do, where you had to present a QR code or a negative test to get into certain things. These are huge leaps and bounds for people to be able to now be part of their common life. So we have done that. But again, the public health measures aren't going to necessarily fix all of the issues. This is a stopgap. The best tool that we have in this is our vaccines. When we were last year around Thanksgiving time, we had a lot of public health measures in place. Then we didn't have vaccines. Now we do.
We have a number of communities asking for more measures. You shut down Saskatchewan a while ago. It sounds like Prince Albert is now asking for more community-based measures as well. Why are we not seeing those approved?
We have a base layer of restrictions and recommendations on that. If the municipalities want to be able to add on top of that, they have that ability to do that. I know Saskatoon has done that in some of their leisure facilities and some of their other facilities that they manage. They have the ability to add on to that if they would like. But we created a base layer across the province to be able to make sure that there are general restrictions and general guidelines out there for people to adhere to. If a municipality wants to add on top of that, that's absolutely their prerogative.
Why do you think Saskatchewan's vaccination rate is the lowest among all the provinces?
Well, I wouldn't say it's the vaccination rate is the lowest amongst all the provinces. We have, in Saskatchewan, we have a whole bunch of health cards of people that have moved out of the province over that are still, that have been vaccinated in other provinces but aren't being counted here in Saskatchewan. So we've been in the process of cleaning that up. Our vaccination rates have increased dramatically over the last 2 to 3 weeks, and we're hoping that that'll continue in the next little while. If we're getting 2,000 to 2,500 individuals that haven't been vaccinated before vaccinated each and every day, we're certainly going to climb up that ladder.
So what does this government think our vaccination rate is then, if we're thinking that thousands of people are leaving?
Well, the vaccination rate of the eligible people is at 84%, which is very, very high. If you look at it across North America, it's extremely high. That's first dose. Second dose is at about 74%. Now, the eligibility, those numbers will change dramatically when hopefully Health Canada will open it up to 5-year-olds and above, and then we can start vaccinating those individuals.
So are you rejecting the idea that we don't have the lowest vaccination rate in Canada? I'm sorry, I'm just confused by that.
No, I'm saying that, yeah, our vaccination rate is lower than other provinces, but it is higher when you look at across North America. And you look at some of those other places in North America that have no restrictions whatsoever, our vaccination rate is way higher than them, and it is increasing every day.
Has Dr. Shahab recommended to you or anyone in the government to put a restriction on gathering sizes, specifically in the home or in public places or private places?
Well, like forever?
No, for recently. Like, has he recommended that at any point throughout the fourth wave to the government to put restrictions on gathering?
Oh, Dr. Shahab provides us with recommendations.
Was that one of them?
Was that one of them?
Yeah.
There was many recommendations that Dr. Shahab provides to us, and then we sit down and we have that discussion with, right now we have that discussion with our emergency operations, and all of that information is going to be filtered into there. So Dr. Shahab has provided recommendations, and we continue to work with Dr. Shahab on his advice on a go-forward
But
basis.
you're not denying that he didn't recommend that. Can you give us an example of some of the recommendations he has made?
Well, I don't have those in front of me, no.
But did he make the recommendations to you?
Dr. Shahab makes recommendations into the Ministry of Health, and then the Ministry of Health makes
So you
recommendations.
don't remember them, or so you don't know what he's recommended?
No, I didn't say that.
Okay, so what has he recommended?
I said he's made lots of recommendations over the last little while, and we have to take those recommendations, as we always have in the past, and then apply them to real situations out there, looking at everything from our modeling to our vaccination rates. Again, this is part of the spectrum that we look at on a daily basis to see whether we have to do. And if you look, as I mentioned, in the last 30 days, we have had a lot of restrictions that have come into place in our province, more than ever.
Can we get the modeling? The public really wants it. We get that it's a crystal ball. No one's like taking it as it's written in stone. Can the public view the modeling? We've released it in the past. How come not now? And can we get it?
Again, the modeling is just one tool. As you said, it's that crystal ball to be able to look forward, and it's not taking into account everything that's happening out there, like our increased vaccination rates. It also doesn't take into account that people under the age of 20, 20% of our cases are under the age of 20. There's a very low risk of those actually ending up in hospital just because of their age, and they're stronger to be able to fight COVID. So the modeling looks at one scenario of this is what could happen if nothing changed from now until a month from now. So it's not the most accurate. We've seen in the past that the modeling hasn't been extremely accurate in everything that we're doing. They were projecting at the end of August that there was going to be 600-700 cases a day. That didn't happen. So we have to look at it, and we have to provide context with the modeling. And I have no issue with the modeling coming out, and we'll work to be able to make sure that we get that out to the media.
Thank you.
But the context has to be brought in and around that modeling, that this is a forecast, not going to be concrete.
Do you know when we can expect that modeling to be released?
I don't have that right now, but probably within a week.
All right, thank you.
Sorry, I'm still really confused about the vaccination rate stuff. So do you think that the province's current numbers are an underestimation then, if there's still something taken into account?
I think some of the numbers, yeah, that is underestimated, because we do have a bunch of people that have moved out of province that still have a health card that are not getting vaccinated here. So we have a group of people, whatever the number is, that are in another province that have been vaccinated, but according to their health records here in Saskatchewan, they haven't been vaccinated. So I think the number is a little skewed.
Do you have any sense of how many that might be, or how long that would take to?
This is something that our EOC is going to look in with the SHA to find out how many of those people actually have been vaccinated, if we can take them off our health card list and clean out that data. We've done it once, and we need to do it again, just because we want to make sure that the actual hard numbers out there are the real numbers reflective of the people in Saskatchewan. And the people of Saskatchewan have been doing a great job of getting vaccinated. We just need to get that last little bit done, and we're working on that right now.
So, Minister, will you be reaching out to other provinces to try to find out how many people may have moved out of province and have actually been vaccinated in other provinces?
Yeah, this is something that our eHealth is working on to be able to clean out that data to find out what it is. And every province has this across the board. And we have to remember that every province kind of accounts for their vaccination rates in a little different way than we do in Saskatchewan. Some of them are in the high 90s, which is great. And Saskatchewan, although we are towards the bottom right now, we're certainly catching up.
You just mentioned that we expect 6,000 cases till the end of October. And yesterday we learned that some patients will probably need to be to Ontario to get cares they need. It's a really critical situation that we are at this point. We need to send those patients there.
It is, but we want to make sure that we're maintaining the proper care for those individuals. So if we don't have the staff, we certainly have the facilities and we certainly have the equipment. And the staff has been doing an amazing job in acute and in ICU to be able to manage this. But if it gets to a point where we have to move people out of province, then we will to be able to maintain that quality of care. And that's why we've been able to work with Ontario, and we're also, officials have reached out to Manitoba to have those discussions as well. I haven't had a discussion myself with the Minister of Manitoba, but I certainly will in the near future if we need to get to that point. Let's hope we don't get to that point, but if we do, we're ready for it.
But do you think that if we have more restrictions, that's the Provincial making as a recommendation, do you think that it could help that we don't need to send those people in other provinces?
Well, any restriction that we put in place isn't going to have an impact, and we have to remember we do for a couple of weeks. We have to remember that that the restrictions that we have in place are very severe. We're limiting people access to certain places because they're not vaccinated or they have to have a negative test. Now, the negative test side of things is something that other provinces aren't doing, so we're making it more accessible for people to be able to do that. But again, the restrictions are only one tool that we have. We've implemented some very, very strict restrictions right now. And we're hoping that this will be enough to be able to, and it seems to have flattened out, and our numbers are hopefully starting to decline.
What are the parameters for triaging patients into the ICU?
Pardon me?
What are the parameters for triaging patients into the ICU?
Oh, I don't have that medical information. That might be better for tomorrow when we have a technical briefing on that. I don't have a medical background, so I couldn't make that decision.
Minister, we still have like the highest per capita cases, per capita deaths in Canada, and you're saying that the restrictions are strong enough. Isn't that an indication that we haven't done enough, that we continue to have the highest per capita cases, highest per capita deaths?
Well, I'm not sure about the highest per capita deaths and the highest per capita case. Depends. You're looking at it at a point in time, not necessarily over the whole. When you say that we have the highest deaths per capita, that's not accurate for the whole pandemic. That's accurate maybe in the last short amount of time. And we have had some challenges. Absolutely, and that's why we brought in these restrictions. We brought in the QR code. We've done all of these to be able to start to curb those numbers, and we're seeing that it's working.
Minister, is it safe for people to get the flu shot and the COVID vaccine at the same time? And if so, what plans does the government or the SHA plan to implement to facilitate clinics where they can get both shots at the same time?
We are facilitating clinics that they can get that. That's a medical question, and I don't know if, yeah. Did you want to answer?
Sure.
We have Dr. Dean here.
Morning, everyone. First of all, thank you so much for coming out to help us spread the word about the importance of influenza immunization. In terms of that specific question, yes, it is safe. And so we really recommend if anyone is out there who still haven't received their first or second dose of COVID vaccine, to make their appointment. There's so many abilities to make an appointment. It's easy. There's more than 300 pharmacies where these appointments can be made. There's some physician and nurse practitioner offices and more than 126 SHA clinics. For the SHA clinic, they can do it online. They can make a phone call, and you only need one appointment, and staff are trained to provide the COVID vaccine and the influenza vaccine at the same time. Just going to pick two different arms, and you're good to go. So really encourage people who still haven't received their COVID to also get it at the same time as their flu vaccine. Thanks.
Thank you. We good?
Just a question about the data set that you developed. It's getting a lot of data for people. Who's it intended for? Is it for the homeless, the addicts, for people who are not applying for the vaccine?
Well, we're in the process of looking at that right now to see, to maybe we can do that in a different way. We have put people up that didn't have the ability to isolate from their family. We have put them up in hotels. Sometimes that creates some security issues of an individual actually staying in their hotel room if they are considered infectious. But we're just looking at what is the best way of making sure that everybody is possibly safe. North Battleford is one option, but we're also looking at some other options, and we've asked the emergency operations group to have a look at that and find out what's going to be the best for everybody. Now, it does create some security challenges when we do put individuals into hotels, but we're currently reviewing that right now.
The deadline for healthcare workers to be vaccinated is approaching. What happens if they don't or don't want to show proof of test? Are they going to be on paid leave? How does that work? Do we know?
That would be an issue that the SHA would deal with. They have some contingencies on that. We're hoping that we never get to that. Honestly, we want to make sure that everybody's vaccinated, and if they choose not to get vaccinated, that they have to get that test. The SHA is working out the details of how often they have to get that test coming in, because obviously they're in a different environment of somebody coming to work in a grocery store that might need that test once a week. They're working in a very different facility. So the SHA will look at that and deal with any issues as far as people in non-compliance. That's an HR issue, and I'd let them address that.
Quebec has suspended their
Yes.
extension for now. Are we looking into that for fear of, not fear, but like just the concern of people not having enough healthcare workers?
Quebec had a different program. They were going to suspend them with pay. We've never looked at that, to my knowledge. And again, we've done very well with getting people to comply versus the enforcement side of things. So we have seen our numbers tick up within our healthcare system. Scott Livingstone was telling me about that this morning, that we have seen an increase, but we obviously want that number as high as possible.
And can we afford to lose any healthcare workers right now?
Well, all the healthcare workers are extremely valuable right now. We want to make sure that that's why we have this in place, is not just to protect the patients, but also to protect themselves and their families. So that's why it's very important for them to get vaccinated.
You mentioned the help that Ottawa is doing right now, but have they told, like, the government in Saskatchewan what could be there too in the next few weeks if the situation is getting worse?
Yeah, if things do not improve, which we're very hopeful that they will improve, if we have to, we'll reach out to the federal government. But right now, we're working with the other provinces to see if we can move any of our capacity out there if we get to that point. But we haven't got there right yet. We were very close. But the SHA was able to move some people around to be able to mitigate that issue.
I'm saying it could be like a good idea to get their help right now, just to prevent a worse situation.
Well, we always look at what we have on hand and then what could come around the corner. Obviously, with a long weekend, there's always the possibilities of car accidents, and there's always that chance of something happening on a long weekend. So we were prepared for that. But that's why we always build in, what our base number is, and then we have a little bit of a buffer zone there of ICU capacity just for people coming in from an accident or an emergency surgery or something like that. So we have that built in. If we hit that point and we're past that point, then we'll start looking at what we need to do to maintain that level of health care provided for those individuals, and that might be out of province.
Thank you.
Okay.
Thanks, everybody.
Thank you.
Yeah, by all means.
Did you want to?
Dr. Diener has something she'd like to add if you have a moment?
Absolutely.
Thanks for the opportunity. I just want to reiterate again, as Minister Merriman said, the importance of getting the flu vaccine. It's really a call to action for everyone who's eligible, 6 months and older, to get that vaccine, not to only protect themselves, but their family, their loved ones, their friends, their co-workers, if you're a healthcare worker, your patients, but most of all to protect our healthcare system that is under tremendous stress, mostly due to COVID at this point in time. The vaccine is safe, it's effective. We have one that we call this year quadrivalent, which means there's 4 strains in the vaccine, so 2 A's and 2 B's. So it's a broader protection than the trivalent we had in the past. I just want to say something about the SHA clinics. Online, if people have that available to them, it's very easy, and if you can put it out there, it's 4, the number 4, flu.ca, and they can make the appointment online for up to 6 people. So that's really easy. Or if you don't have access to a computer, you can phone, and then it's 1833 SaskVax, SASKVAX. So really, for all of us, there's no excuse in terms of accessibility to make those appointments as soon as possible. So last one, call to action. Please get your flu shot. Help yourself, those around you, and the healthcare system as a whole. Thanks.
Could you just get your name and how to spell it?
Sure. It's Dr. Tania Diener, Tania Diener. And I'm a medical health officer in Regina, but also the medical health officer lead for immunization and travel health in the SHA.
Thank you.
Thanks.
Yeah, if you guys all